I know if my back pain is from muscles or disc is the question. So in order to answer that, I've got to bring a little addendum to this answer. You can have disc issues that don't necessarily cause any nerve problems. They can cause localized muscle contraction that cause pain. So a lot of times we discover disc issues when there is a chronic problem or there is a nerve issue that we send the patient out for an MRI and sure enough it's a disc. And then there are times that that's just discovered by accident. So just because you have a disc issue does not mean that this is a major issue. It just allows you to understand the importance of focusing on functionality in movement, because that disc issue that may not be causing that big of a problem can get a lot worse and become problematic. The location of the disc bulge, disc herniation, or disc protrusion is more important than just having a disc issue. So when you have the spinal column where there's a line of holes that the spinal cord goes through, you can have herniation encroaching and putting pressure on the spinal column or the spinal cord. And then between every two vertebrae, there's a set of nerves that come out through a hole, right side and left side. That disc issue, when puts pressure or puts more pressure in that hole where the nerve is coming through, that becomes problematic. With every disc issue, there is always a localized or maybe not so localized, depending on what else is happening, muscular issues as well. So generally speaking, if there is a nerve issue as a result of disc problem, you can have radiculopathy, radiation or pain shooting down in a specific patterns, or having weakness in certain muscles. There is a presentation that goes hand in hand. Now, a lot of times also when it comes to disc issues, it's very positional, meaning, for example, I may just stay in what we call antalgia, meaning I'm in this position, forward position, because that provides the least amount of symptoms for me. And if I go back in that position and in that back position into the area of irritation, I may have pain, and it typically is localized, or it can go down the lower or upper extremity depending on what we're dealing with. So muscular issues typically with massage or with manual therapy can get improved. Disc issues do not, if it is putting pressure on the nerve. So I kind of answered your question, but it wasn't a yes and no question, so I had a little bit of a detail. If you have you have an issue with your back, the best thing to do is to actually go to an expert, a provider that actually knows what they're doing and what they're looking for. When it comes to patients coming to me, the only time I take a patient as a patient is if they want to understand the functionality in their movement and understand what they did that caused the problem to begin with. That's the only way I see my patients, because bottom line is, as nice as everyone is, I really don't want to see people for the rest of their lives. So my goal is to make sure they understand how to be, and they can prevent, they can predict, and they can understand how to be so they don't cause the problem. If they don't want to do that, then my practice is not the right practice for them in essence. So understand that providers make a difference, and certain problems do need to be addressed by a competent and caring provider. Thank you so much for watching and following us, and until next time, take care.